Now, what about, anxiety and depression, especially in teens?
Yes, well, they're finding that anxiety and depression is increasing.
Right.
Now, I have this chart here, and it was, the study was conducted in 2015 by the U.S. Department of Health and Human Services. And so you can see here on this side, it says depression by the numbers. And it says 3 million adolescents ages 12 to 17 in the U.S. who had at least one major depressive episode in the past year, which was 2015.
Right.
And you can see that this number has increased over time. So we're working here from 2006, it was 7.9, and 2015, it went up to 12.5. And I think that it has increased since then because we added 3 more years, 2018. And down here, it talks about how girls are more prone to depression at 19.5 versus boys 5.8. And then we come to this side, anxiety by the numbers, and we see that 63 million teens between the ages of 13 and 18 had anxiety disorder. And that's a diagnosable disorder. And you can see in this little square here, it says 25% of the teens in this age group have this condition.
Right.
And boys are more prone here to have anxiety attacks or episodes. Girls still are at a high rate, 30.1% versus the boys' 20.3%.
Right.
So you can see that anxiety is really increasing over the course of time, although some people, I think, are not focusing on that, and they're wondering why teenagers are so anxious. And I think we can just look in the newspaper or the news and realize why they're so anxious these days.
Now, what do you think is accounting for this big jump in terms of depression and anxiety?
Well, if you think about it, Rick, if you just look from 2000 to now, that's 18 years.
Right.
So we're talking teenage years here. And teens were born into a world where they know terrorism. If you think of, we just commemorated 9/11, right?
Right.
So they were, if they were born in 2000, they were just a year old. And they know nothing but this. And the world is not, they're feeling that the world is not safe for them. So I think that's a major issue that we have to look at. Also, we have other things going on, like cyberbullying, and teenagers, it's known that they can listen to things on the internet and harm themselves, maybe even commit suicide. They can look on the internet and find out somebody who committed a shooting, and there's such a thing as copycat.
Right.
And so they follow that here on the East Coast. And so things are different than when we grew up, right? So they have these issues. And the other thing is there's so much competition with teenagers. So they're looking at their grades, they're looking at their, they want to win the championships, get into the college of their choice, they want to be popular socially. And so these things create really phobias and fears, and especially if they don't have any coping skills, it leads to these vulnerabilities the psychiatrist was talking about, the substance abuse, the alcohol abuse, and even eating challenges like eating disorders. So we really have to focus on teaching teens coping skills.
Right.